If you are struggling with hair loss, there are non-surgical effective options available for you.
Hi, my name is Dr. Anthony Frohl. I'm the director of Philadelphia Hair Restoration. Sitting next to me is Dr. Ken Nam, who's the associate director of our organization. Please watch the video to the end as we have some effective tips for you that'll help you decide your hair restoration method.
Non-surgical hair restoration. So there are many treatment options without the surgery to treat your hair loss. One of them is PRP, platelet-rich plasma. It's a plasma injection. Other one is low-power laser light head that you can use to stimulate your hair follicles. And also medications such as finasteride, oral finasteride, or even topical finasteride. Also, Minoxidil is another option.
We can add to that micropigmentation.
Right. It's another treatment option, but this is not a permanent solution such as hair transplantation. If you don't have a good donor in the bag, we can always try with SMP first.
You do not necessarily have to undergo surgery to have an appearance of a greater amount of hair.
Advanced therapies for hair growth.
One of the advanced therapies for hair loss involves PRP, or platelet-rich plasma. This is a method where we draw the patient's blood, we spin it down to get the platelet-rich plasma. This then is injected into the scalp areas and will help to generate growth of latent hair follicles that are there, but they're very immature, they're lighter, they're not robust. And what the PRP does is enhance thickness of those hairs to give a better volume to the scalp. It should be noted that this is not doing a transplantation, not transplanting hair follicles. And this method is often used, for example, when someone doesn't have good donor site, not hair follicles to transplant. So we try to stimulate what the patient has left into the fullest hair they can have. So there are other options, which include steroid injections and immunotherapy. We at the Philadelphia Hair Restoration Center don't use these methods primarily because the PRP method is more effective. Steroids have been studied for a while and can enhance the hair growth if there's an inflammatory condition to the hair. Immunotherapy is a fairly aggressive, even though it's not surgical, method of trying to stimulate hair growth. We have to realize that immunotherapy has some downsides. It could suppress the immune system and have medical effects that we don't want to induce on our patients. So we do not use these two therapies, although certain centers might.
SMP, scalp micropigmentation, is one of the non-surgical cosmetic options for hair loss. But this is not a permanent solution. You do have to get, just like other tattoos, the color fades away. So you do have to get retouch-up now and then, maybe once in 6 months.
How do we educate our patients and make the decision on what non-surgical option is good for them? If the patient is struggling with those two decisions, whether to use a pigmentation method, which is effective and does a nice job, or to pay a hair piece, we have to engage the patient in making that decision and decide inconvenience, for example. It's a hairpiece inconvenience for their lifestyle, right? The pigmentation, they don't have to worry about taking care of it, but it has limitations in the volume. So we describe those two things to our patients, right? And they have to come into the decision-making process with us.